Hi, my name is Valerie Leisure. I'm the Director of Physical Therapy here at Arkansas Surgical Hospital. I'm going to be reviewing some how-tos for your mobility after surgery. Your safety is very important to us, and we want to make sure you know how to navigate your stairs once you go home. If you have an inpatient surgery and your doctor orders physical therapy, we will practice this with you while you're in the hospital. If you have railing at home, you will want to utilize them for your safety. When you go up the stairs, you always want to lead with your non-surgical leg. That leg will help pull you up the step. You will continue that, bringing your surgery leg to the same step. We're going to turn around and go back down. Going down the stairs, you'll want to lead with your surgical leg. The other leg will do all the work to help lower you down. If you only have one handrail, you can either place both hands on the rail, use a cane on the opposite side, or have a family member that you can hang on to for more support. If you do not have railing on your stairs at home, we'll teach you how to go backwards up the stairs using your walker. It sounds very intimidating at first, but it allows you to bear your way onto your walker instead of your surgical leg. First, you'll want to back up to the stairs as close as you can. Place your weight onto the walker and step back with your non-surgical leg, followed by the surgical leg. If you have multiple steps, you're going to take the walker onto 2 steps. You will slide your hands to the back, kind of to put your weight through the legs, and have a family member hold and support the front of the walker. Stepping back with non-surgical leg, followed by your surgical leg. Let's do that one more time. Good. When you're coming out of your house, you'll place the walker 1 step forward, again, your hands being on the back and someone supporting the front, but you're gonna go down using your surgical leg first, followed by the non-surgical leg. When you only have 1 step left, bring this walker flat to the ground, leading with the surgical leg, followed by the non-surgical leg. If you're on crutches after your surgery, you will do the same sequence, leading with your non-surgical leg going up the stairs and your surgical leg going down the stairs. You will keep the crutches in the same position as your surgical leg. Turn. Crutches and surgical leg together.